Welcome everyone to our October meetup. As you know, at 2Unstoppable, October is Breast Cancer and Exercise Awareness Month. And so we always make this month special. And this month's virtual meetup is extra special. We have an incredible guest, Dr. Kathryn Schmitz, here with us tonight, and she will be introducing our surprise guest, who we're delighted to have here, Sarah Sweeney. We're excited to have all of you joining us. As you know, we've been looking forward to this special meetup for quite some time. So I'm going to ask Ilana Gammerman, my co-founder at 2Unstoppable, to introduce Dr. Schmitz.
Good evening, everybody. I am definitely honored to welcome and introduce Dr. Katie Schmitz to our 2Unstoppable meetup / webinar tonight. Dr. Catherine Schmitz is a distinguished professor of public health sciences at the Penn State College of Medicine and Penn State Cancer Institute. She was president of the American College of Sports Medicine from 2017 to 2018, during which time she co-chaired the International Multidisciplinary American College of Sports Medicine Roundtable on Exercise and Cancer Prevention and Control. She is the founder of the Moving Through Cancer initiative of the American College of Sports Medicine, which has a bold goal of making exercise standard of care in oncology by 2029. I feel like I want to repeat that again. So we certainly are working with you, Katie, on that. This book that she's here tonight to talk with us about was written to further that goal. Dr. Schmitz has had over 30 million in peer-reviewed research funding from NIH and foundation sources, and she has published over 260 scientific peer-reviewed publications. She currently lives in central Pennsylvania with her wife, Sarah, their 2 dogs, Molly and Milo, and she has 2 sons, Mac and Tom, and we really welcome both of you to our meetup webinar this evening.
Thank you. Thank you very much. It's really, really delightful to be with everybody tonight. And this is so special for me to get to have my wife with me to do this. So can I introduce Sarah now? Oh, I get to introduce you now, and I get to embarrass Sarah. Okay. Ilana got to embarrass me. Now I get to embarrass Sarah. So this is Sarah Elizabeth Sweeney. She is an architect, and she works for an organization called the Michaels Organization that does a lot of affordable housing work. And that is kind of her vocation. And in fact, one of the ways that Sarah and I came together as we started to get to know each other was the realization that both of us were blessed to have work that we got paid to do that was not just a job, but was a vocation. My work in exercise oncology is a passion for me, and her work as an architect is a passion for her. So we try to understand each other's work when we talk to each other about it, but our minds are very different. About a year and maybe a couple of months past a year when she and I had started dating, I believe it was something like 3 days after she moved in with me. Yeah. Sarah was diagnosed with stage 3 squamous cell carcinoma in her right nostril. And what was your right nostril?
Yes, it was your right nostril and my
right.
nasal septum. It was going over to my left nostril.
So she'd been misdiagnosed for about a year. You know, we initially misunderstood because there is a type of skin cancer called squamous cell carcinoma that is very benign, and you kind of scrape it off and no surgery and you're fine. And I thought that's what it was. And I still remember we had a meeting with medical oncologists, radiation oncologists, surgical oncologists, nurse navigator, social worker, you know, all these people in the room. And I'm like, why do we have all these people in the room for this benign little skin thing, you know? And that's when the penny dropped, and we realized that we were dealing with something really serious. And over the year and a half, maybe even 2 years after that, We dealt with surgeries, reconstructive surgeries, combined chemo and radiation, and
Hyperbaric chamber.
yeah, and all of the weight gain and not taking good care of ourselves that came along with it. She was very, very much the inspiration for writing this book.
Amazing.
There's Sarah. And she just hit 5 years post cancer.
Yeah.
So everybody should clap for that.
I think a lot of us on this in this virtual meetup understand some of what you've gone through, right? That diagnosis, the treatments, and then hitting a milestone like that. Somebody just wrote congratulations in the chat. So we celebrate with you. So there's a few things that you said in the introduction that lead right into my questions. And so thank you so much for setting it up perfectly. So we're gonna get to you in a second, Sarah, but first let me just start. I'm gonna call you Katie, is that okay?
Please, yes.
Katie, you talked earlier about how both of you, the work that you do is your passion, it's your vocation. So start with just what excites you about the field of exercise oncology?
Oh my goodness. We are at a really interesting moment in the field of exercise oncology, because I think that we really have like two paths that are going to happen at the same time now. One path is, scientists use a system called PubMed to look up scientific papers. And if you today, right now, Michelle, were to go onto PubMed and search for exercise and add cancer and say humans and clinical trials, you would get over 20,000 hits. 20,000 hits. That's crazy, right? So that's a lot of research. But the research that's been done to date, to this point, has largely been things that focus on quality of life, on body composition, on function, lymphedema, outcomes that matter to me, that matter to Sarah, that matter to Michelle and Alana, that matter to the people on this call, but that don't matter to Medicare, Medicaid, and our insurance companies. Mm-hmm. And so, we really, we are at a point where we need to do research that will make a difference to those payers. And there's two types of research that need to happen. One type of research is much more about trying to understand dosing of exercise that would be most useful to potentiate the therapies that are already given. So in particular, there's real interest in immune therapies and whether it's possible that we could actually make response to immune therapies better by virtue of having people exercise at a particular dose. And we need to do that dose finding while they're getting, so that kind of precision medicine research has to happen, okay? In addition to that, we also need to do implementation science and health services research. And what I mean by that is we need to understand whether exercise during treatment and after treatment is cost effective, whether it alters healthcare utilization, and we need to train the whole of the oncology clinical enterprise as to how to add exercise into the mix. Right now, medical oncology is the place where we typically go and say, you guys need to add this, and they are crying uncle. Your audience may or may not be aware of this, but we have a massive mismatch happening in this country between the number of oncologists that are trained and working and the number of patients, and it's getting worse by time. As we get older, more and more people are diagnosed with cancer. Rates aren't going up. That's not what I'm saying. It's just there are more older people, right? But we're not having more oncologists, which means that oncologists have less and less time with their patients. So we have to start to figure out some other system that includes the nurses, that includes the medical assistants, that includes the front desk staff people. I don't care who it is. I just want somebody to talk to every patient about exercise, right? It needs to be an assumed part. We need to pay 2Unstoppable to talk to patients as they're coming through their appointments. There needs to be a way for us to pay for that kind of counseling and we need to show that it is cost effective to do so. So what really excites me is that I think that we're attacking the problem now in two important ways. And I think that there are some brilliant scientists who are working in each of these areas. I personally have chosen to go down the road of the health services and implementation science. That's the direction that I've chosen to go. It doesn't mean I'm not still working in this other one, but I work on it collaboratively.
Right. Oh, music to our ears. Ilana and I are just beaming because this is music to our ears. So, you talked about Sarah being part of the inspiration for writing this book. You've done so much research. And why did you write this book, Moving Through Cancer in this way?
Yeah, I wrote it because, okay. So the story that I'll tell to try to explain this is that back in the 1950s, Dwight Eisenhower, while he was a sitting president, had a heart attack. And his very famous cardiologist at the time, Paul Dudley White, was sharply criticized for getting him out of bed so soon, 3 weeks after his heart attack. Well, yes, Michelle, we laugh now. We laugh today about that because we've had a culture shift. Okay, so somewhere between the 1950s and now, we not only know from the science, but the average person on the street, if you ask anyone on the street with an 8th grade education, hey, your dad had a heart attack last year, should he be exercising to strengthen his heart? They're going to say yes. We've had a culture change. We had the same culture change back in the 1980s for exercise and back pain. We used to tell people to rest, right? We had the same culture change, I'm not sure exactly when, for exercise and pregnancy. It was before I was pregnant, so I know it had to be more than 24 years ago because the advice had changed by then. But we seem to have these culture changes, right? And now the average pregnant woman knows, oh yeah, I should be exercising, right? But right now, today, as you all know, no one on this call is going to see this as a problem because they know otherwise. But if you ask the average person in the United States with an 8th grade education, your Aunt Betty has, breast cancer. Do you think your Aunt Betty ought to be exercising? They're going to say, heck no. Rest, take it easy, don't push yourself. That's the culture of cancer. And so I am interested in doing things that will help us to shift that culture. And I knew that writing another scientific paper was going to get me nowhere. And so I partnered with an oncology journalist by the name of Gabriel Miller, and he helped me with doing the interviews for this book and helped me organize it and put it together. And the idea here is to take what we know, what we are sure of in the scientific evidence base, and translate it for the person with an 8th grade education.
That's amazing. And having been privileged to read an advanced copy of the book and get through the whole thing, I can say that it is written for everyone. And even while you're going through treatment and you might have, brain fog or chemo brain or exhaustion, you can still read the book because it's readable. It's a little entertaining too. It's very real. It's very real. And so that kind of leads me to my next question, which is that, you went into writing this book with this wealth of expertise and experience, years of your own research, the incredible work you've done in your own labs, the roundtables you've led, and the work that you brought to the table of so many of your colleagues as well. And then you had your own personal story with Sarah. So how did your personal story change the way you approach this book?
Oh my goodness. Well, first off, I cried a lot while writing it. It was really, we would, write a section and then I would, put it in the drawer and then bring it back out, which is how you should write something. And I would reread something that I'd written and I cried a lot. Sarah read things to check me, because I occasionally misremember how many reconstructive surgeries she had on her nose. I don't know, 100, 3,000,
Felt that way, right?
yeah. It made it, so that I wasn't just talking to people as a scientist. I was talking to people from the perspective of having lived it in my own heart, in my own life. And from the perspective of that, horror that is being the primary caregiver of, oh my God, I can't do anything. I can do nothing. I have no power over this. And so there's a humanity I hope, in the book that arises out of, I think I might have been a little more strict about what I recommended for exercise at various points during treatment, had I not been through what Sarah and I have been through together.
And I think that's what makes it so real. And it's, as we've talked about a little bit, it makes it so in line with the approach that we take here at 2Unstoppable, which is that, we get it. We get it. And so there are days when it's really hard. And there are days when you have to forgive yourself for not being able to get any further than the mailbox, or not even to the mailbox. So let's talk about that a little bit, a little sneak peek into the book, which was that, Katie, you talked about that it, even with all of the vast knowledge that you had, when you were both first faced with this diagnosis in your lives, it didn't even occur to you to get Sarah moving, right? And then eventually it did. So I'd like you to each talk about that. Like, what was that like when you realized, wait a minute, we might be able to help her outcome by getting her moving.
Yeah. So that was, has to go into most embarrassing moments category of, Sarah, as you can see, I mean, she's sitting on a pillow so that you can see her. She's a tiny person. Okay. So, she didn't have that much lean mass to begin with. And, and I was so completely deer in headlights. I just started a new job. I was living in a new place. It was very confusing. I mean, Trump had just been elected. I mean, there's all kinds of things were happening. No, I'm not kidding. There was a lot happening, like in our personal and our national lives, when she was diagnosed. And
we had just moved in together.
We had just moved in together, like 3 days before her diagnosis. Oh my God. So I do, I mean, speaking of, giving yourself forgiveness, I very definitely have a lot of forgiveness for myself about this. At the same time, it's like, I think that Sarah's experience of not just the surgery, but the combined chemo radiation would have been really different. And she would have suffered much less, I think, had I gotten her going with a strong, really strenuous rehabilitation program. I got to tell you, I think that there's two things that I think of as secret sauce in this book, and one of them is the rehabilitation. So, getting people when they're diagnosed, say, you need to work out hard now,
Yeah.
But it was actually the moment that I realized I could help was when the fatigue set in. And when she was doing combined chemo radiation, and I went, oh, she's fatigued. Hey, wait, no, I know that one. I know that one. I know what to do. And then I'm curious to know, I mean, I know what I told you to do, but how did it feel to you for me to be telling you to exercise at that point?
You're taller than me, so there's that. It felt good because I was working out with a trainer, but I wasn't working out that hard.
Mm-hmm.
And then, you know, she was just saying, just walk on the treadmill.
Yeah.
And, you know, I did, because I thought she knows what she's talking about. I'm going to do this. And just as a side anecdote, I look back too now and think, like, right now, you know, I'm running and starting to train for this half marathon. I'm literally thinking, why the hell wasn't I not doing more back when I was going through treatment? Was it, you know, like, yeah, you know, I just question it now. Like, why wasn't I letting her push me more? Like, why didn't I do more?
Yeah, there was only so much I could push.
I know. And I probably was a lot more tired and things than I remember.
Yeah.
So
You got mad at me.
yeah.
Well, that's one of the things I was going to ask, is that when you were being pushed or encouraged or whatever, to exercise on those days when you were very fatigued, or you didn't think you could do it, or maybe, you know, emotionally you didn't feel like it,
Yeah.
right? It's hard. On the days when you did it anyway, because you either trusted Katie, you know, she knows what she's talking about, I'm just going to do it. What did that do for you? How'd you feel?
I felt better. I felt stronger. Like, I actually remember vividly being on the treadmill and doing it. And, you know, I was at the house by myself, and I literally remember a lot of times going like, yeah, come on, you know, you can, like, just, and it felt good. It empowered me.
Yeah.
And notably, Sarah did combined chemoradiation. And if you go look in the literature, 35% of head and neck cancer patients who go through combined chemoradiation end up in the hospital and having to delay and extend their treatment or cut their treatment short and not get all of what was originally prescribed. Sarah got every single dose on time, every single radiation treatment on time. She finished every single ounce of what, and so we're here 5 years later. So
amazing.
Yeah.
So let's talk about it from kind of the research that we know, and how that, and what do we know about exercising during treatment and it helping us to be able to complete treatment? You know, what is some of the basic stuff that we do know about why that is?
Right. So this is an area of active investigation, as you probably know. And I have an ongoing trial, collaborative trial right now with Dana-Farber Cancer Institute and Kaiser Oakland. And, you know, we'll have results by next summer. And this one is resistance training in colon cancer patients receiving chemotherapy. There is also, I'm delighted to say, the National Cancer Institute has decided that this is an area of special interest, and so put out what's called a request for applications. And so something close to 20 investigators have replied to that RFA, which is called INICTO for short. And those grants are getting reviewed November 10th, which I know because I have one in there in the mix. And so, you know, there will be some really high quality science that we will have in 5 years to answer your question. The preliminary evidence that we have to this point is from 4 different studies. One in Germany in blood cancers, which showed an absolute benefit of exercise on relative dose intensity, on ability to complete chemotherapy, as well as on overall survival. Another one from the Netherlands with breast and colon cancer patients, showing that, in fact, doing a combination of aerobic exercise and resistance exercise on a regular basis, supervised exercise during chemotherapy, made a substantive difference in people's ability to complete their chemotherapy on time. And then 2 studies that came out of Canada from Carrie Cornier's lab. And both of those studies show us that in breast cancer and in lymphoma, there is a benefit of exercise. What I find interesting about this research so far is that it is supervised exercise. Now, in light of 2Unstoppable and what you all do, supervised exercise need not be in person. It can be virtual, but doing a virtual session with someone where you are watching them do the exercise and they are watching you demonstrate it is supervised exercise. And so I think this is a brave new world, and that you all have the capacity to really make a difference across the entire country. So I think the preliminary evidence tells us that there really is a substantive effect. Now, as to why would this be? What are the mechanisms for this? One of the mechanisms that is thought to underlie this is body composition. And the reason for this is that the drugs that we give people in chemotherapy are largely going to be more lipophilic, meaning they go into the fat, or more hydrophilic, which means they'll go into the muscle. Okay, so what that means is that if you change the balance of how much fat you have or how much muscle you have, depending on the balance of drugs that you're taking, then you can alter the clearance of the drug in a way that will reduce toxicities. So changing body composition in a very particular way, sometimes adding muscle, sometimes reducing fat, all right? It depends on the drug cocktail, right? So that's one of the ways that we believe that exercise has this effect. Another way that we believe that exercise has this effect is through alteration in inflammation. We have gorgeous evidence over decades of work that tell us that exercise training reduces chronic inflammation. And we know that having a dose of chemotherapy increases the body's systemic inflammation. It's one of the reasons why exercise is helpful for fatigue. One of the mechanisms through which exercise has its effects on fatigue is by reducing inflammation. Okay, so it's possible that that could also change tolerance to chemotherapy as well.
Thank you. That was going to be one of my other questions, was about fatigue. So you got right in there. And so Sarah, when you were going through treatment and you were trying to keep moving and stay strong and keep up with it, were you also doing some sort of resistance training, or was that like? And I'm not testing.
No, yeah, no, I wasn't. I started in January seeing my trainer still.
Oh.
For some resistance. You know, I don't think I was. You know why? Because I think of the forehead flap, and I was nervous about any kind of pressure on that. So I was just doing the walking on the treadmill. Yeah.
And that's actually, I will say, I feel like, you know, and I talk about this a little bit in the book, that I think that combined chemo radiation is, I mean, I just think about it for a second. I mean, you've been through chemo. Did you do chemo? You did. Okay.
So I personally did both chemo and radiation, but separately.
Right. But imagine doing them at the same time.
Yeah.
Like, I mean, what, you know?
Right.
So, you know, so I actually.
And no wonder many of the patients don't complete the treatment on schedule, right? Or at all. So the fact that you were moving at all is really amazing.
I was pretty impressed that we got her walking on the treadmill.
That's amazing. Katie, I have a couple other areas that I want to make sure we cover. And one of the things that we love in the book is that your book includes recommendations on incorporating social support with exercise, right? You mentioned fitness buddies, exercising in a group, community. So, you know, those of us who are part of the 2Unstoppable community understand all of that. And you also included the caregiver having a potential role in exercising with the person they're taking care of, with the person in their life. So of course, these are some of our favorite parts, but, you know, both in your personal experience, but also in your vast experience in this field, can you talk a little bit about the social support component and how that plays?
Right. So I can tell you that it plays a bigger role for some people than others. The research in this area tells us that men who have cancer, it's very, very difficult for us to get men with cancer to exercise unless we bring along their partners. And the person who has done really just tremendous work in this area is Carrie Winter-Stone at Oregon Health Sciences University. And she was the one that cracked the nut of figuring out how to get the prostate cancer patients exercising, because, before her, it'd been, I don't know, a decade, just failed trial after failed trial after failed trial. Nobody could recruit the prostate cancer patients. Nobody could get them to exercise. And she was like, yeah, I wonder if I invite their wives. I wonder what would happen if I invite the partners, and she has a whole program of research now that is not just about prostate cancer, but is about, the getting the partner exercising and having that being sort of a focus. What I myself have noticed anecdotally, and I have seen in the literature as well, is that, I keep having the experience of hearing from survivors that they don't want to go sit in a circle and drink coffee and eat donuts and talk about having had cancer, that that's not of interest, that the support group, as we envision it, is not palatable, right? But what I then also notice is that when I bring breast cancer survivors together to exercise, you get them in the locker room and you can't get them out of the locker room, because, they're having a great time chatting away and they go off to lunch together, afterwards, or they go hang out, at the wine bar or whatever. But, they want to talk to each other and they want to share their stories, but they want to do so in naturalistic settings that have brought them together to do something healthy and positive for their lives, not because they were coming to talk about their cancer.
That's right.
So
Yeah.
I think that's the thing that I think gets really cool with 2Unstoppable, is that you have created a community, right? And so, figuring out how to capitalize on that, because the social fit is the stickiness. That's why people will come back. I mean, you can exercise anywhere. You can go to Peloton, you can go to, there's all kinds of places where you can go, but where's the community? Where are your people?
Yeah.
You know?
Yeah. And it helps to exercise either virtually or in person or however it is with someone who gets it, who gets why you're doing it, who gets how hard it is in unsafe days. And it is, as you said, it becomes a forum for being able to talk and support each other. So that social support and exercise combination is definitely key. So Sarah, I wanted to just ask you, if there was one thing that you wanted everyone here to walk away with that you learned about this, what would you share?
Ask questions. Yeah, I would say ask questions. I look back and I don't know that I asked enough questions.
Mm-hmm.
I wish I had done more. And to move. And I say that not just because Katie's sitting next to me, but even when I was in the hospital after I had the rhinectomy and I had a forehead flap, I was in the hospital for 5 days. And I started to walk laps around on the floor. Mm-hmm. And I noticed that I was the only patient doing that. And I think the 4th day I was there doing it, there was a woman, her husband was in like 2 rooms down from me, and she saw me doing laps all the time. And she was just standing outside his room. And I remember she said encouraging words, and that I've been watching you walk the halls, and I just think it's great. And so I was already up and moving. And that was, I think my sister, who's a nurse, was the one who was like, you need to start moving.
Wow.
Yeah.
She's a fitness enthusiast as well.
Yeah. And
So,
she was a
yeah.
wound
So
care.
lucky you had them coming at you from angle, telling you to
I
move,
can't
right?
even tell you
Couldn't get away from it.
how many God moments and angel moments I feel like I had through this process. So yeah.
Yeah.
Yeah. I used to say that all the different supports I got, it was like the equivalent of those beach balls that people throw up in the air at graduations.
Yes.
And everyone was hitting it in different ways at different times, sometimes just with their fingers, sometimes really diving and
Right.
pushing it up. But it was every single individual person and their contribution that kept me afloat, right? So it all mattered, right?
I would just say, like, ask questions. If you're not clear on something, if you don't understand, ask the question. And if the doctor says something to you that you're not happy with, don't have, you get that feeling of shame, like, oh, I'm not going to say anything else. Yeah, screw that.
Yeah.
Move past that and ask your question.
Yeah, there was some stuff that was cut out of the book actually that was relevant to what Sarah is saying that I feel like is worth saying. Can you talk about the tip of your nose conversation?
Yeah. So I'll just say that I'm actually doing a little Instagram story about my whole experience right now, which I just started 2 weeks ago. So I can have Katie share that information with you
Yeah,
guys.
that would be great.
I'm actually right at that part of the story right now, almost next week, actually. But when I was diagnosed, they said, we're going to have to remove the tip of your nose. And like, I kept thinking the tip of your nose is just that little tip, right? And that's the tip of your nose.
Yeah, exactly. That's the
And
tip.
right. And then one day I was with the surgeon who was originally going to remove my nose before I switched to pen. And I said, can you show me what the tip of my nose really is? And I still remember that the room just got dead silent. And it was the surgeon and a fellow. And he said, you get a mirror. And he gave me a mirror. And he took a little instrument and he traced all around my nose. And I remember like being, the tip of your nose is all of the part of your nose that sticks out from your face because your nose goes back into your skull. And I remember I have a picture and I'll have it next week of me sitting in the car.
Keep going. I'm gonna get the noses.
Oh, yeah. Sitting in the car, just, like I'm going to lose my whole nose.
Yeah. The reality of what was coming. And
The reality of what was coming. Yeah.
I
Yeah.
think many of us can probably relate to some, maybe not that. Oh, everyone can see. Yes, I see.
Okay, so what you'll be able to see here, and I'm going to turn it a little bit one way and the other, okay? So that you see it.
That's my
That's what her nose looked like.
Oh,
This is
they
a
make them
cast
so-
done of her nose
Yeah.
that was then shaped by a sculptor to show what her nose looked like prior to any cancer.
Wow.
This is what her nose looked like the day of surgery. You can see the bumpiness.
From the mass or yeah.
Yeah,
Wow.
really. Here, maybe if I
Yeah.
back it up.
It
a
was,
little bit.
I look like W.C.
Yeah.
Fields.
She had a bulbous nose by the time her surgery was done. We thought of doing this like 3 days before the surgery. We had
She did.
a sculptor come and
Oh,
do
wow. Oh, that was something you did just to
Yeah.
preserve that
Yeah.
memory. I see. Wow.
this. Yeah, just so we would have this memory of like, this was her cute little nose.
Yeah.
You know, she had a very cute nose. So,
It's something that many of us can probably relate to just in general, that we're told what our treatment is going to be and what some of the side effects might be. but we never fully understand what they're
Oh.
talking about,
Oh.
whether because they don't actually tell us, maybe because they don't think we can cope, or maybe
Yeah.
because we don't hear it, right? They tell us all these things and we just can't process it all. So, there are many side effects of various treatments that we don't even have any clue about, right? So, and I think we can all relate in our own different ways, depending on what our own personal treatment experiences were. But that's, I think, a common thing. And I think the exercise actually relates to that, because even in a very simple example, like, who knew we were going to lose muscle mass as a result of treatment? Like, why would that be a topic of, right? Or who thought we would gain weight on keto? Right? That's just like add insult to injury. But, and someone just put in the chat, every visit included a new surprise, right?
Surprise.
Right. And this is stuff that, and this is an example of how we talk about at 2Unstoppable, how cancer can feel very out of control.
Very.
And one of the benefits of exercise that has nothing to do with the physical side is it's something that makes you feel like you're in control.
Yes.
It gives you something to do that you can control, even if sometimes on a given day, it's not exactly, doesn't look like the way you'd like it to look, but it does make you feel like you're in control of something, both during the process, from the minute of diagnosis through treatment, as well as afterwards.
Well, I also, and I think I mentioned that I think there's, two things that are the secret sauce in the book. And the second secret sauce has to do with, if you follow the program, you follow, do like the program changes according to where you are in the treatment. But if you do it, then it's sort of like, the analogy would be, it's sort of like driving your car every day. So that then if there's a new bump or rattle in the car, you go, oh, what's that? That's new, and you understand what it is. Now, if you haven't driven the car and you go drive the car and it makes a rattle, how do you know if it's a new rattle or not a new rattle? So the analogy here is you're going through your treatments and you use your body, you exercise, you use your body, and you know how you feel, right? And you're like, okay, well, I can only walk a mile right now because I'm really not very energized. Okay, got it. Okay. And then you go out to walk the next day and you can't go 200 feet.
That's right.
Something's going on, right? By virtue of using the body on a regular basis, it's like driving the car every day. When there's a new rattle.
That's right. And you're so much more attuned to your own body.
So much more attuned.
So one of the components for those people who haven't gotten the book, I know some of you have ordered it and some of you have received it. There's a piece of it that suggests logging, right? It's keeping a log every day about how you're feeling and what you're doing. And that can also help to motivate you. So if you know that I was really fatigued, but then I got on the treadmill and I felt actually more energetic, surprise, it might actually motivate you the next time when you don't feel like doing it. And some of us have had that experience. We knew that whatever it took to drag us out of bed or off the couch or out the door, we know that having that experience and sort of recognizing it, acknowledging it, including it in a log helps us to do it the next time. So it increases that motivation as well. And that's a big piece of what we're about. So I do want to give people a chance. If anyone has questions, this is your chance to include it in the Q&A or in the chat. And Ilana's going to be monitoring that. I still have a couple more questions for you. So I'll keep doing my questions. And then if participant questions, attendee questions are coming in, we're happy to pose those to Katie and Sarah. So one question that did come in advance, Katie, was, do you have specific recommendations for women living with metastatic cancer?
Yes, my primary recommendation is that you really, really need to be exercising. So actually I have now my fourth funded study working with metastatic breast cancer patients right now called Nurse Amy. What we know is that actually there are some brand new recommendations that have just been published that I would love to, Michelle, I would love to share with you so that you can share as well with your community, to make sure that that information is being transmitted quickly. But there's new recommendations for people with bone metastases in particular, and it's good news. The good news is that there is. I see something about the cancer exercise app, and I'll talk about that in a second. But there is guidance for exercise for people with bone metastases, and for the most part, the answer is please do exercise. And the way that you exercise might be slightly different. So, for example, if your bone metastases are in your hips, then we might have you do things that are less weight bearing. You might do more chair-based exercise. You might pull on the bones in a very different way with resistance training. If your bone metastases are in your spine, then we're not going to do twisting motions. So there are some fairly specific things and recommendations that can now be made. I also recognize that there are plenty of women living with metastatic breast cancer who do not have bone metastases, have metastases in other places in their bodies. And so, so I don't want to assume that that's the case for this particular person, but I think that it is the other thing that happens with metastatic breast is that it becomes, I don't want to be indelicate, but it's a little bit of kind of whack-a-mole that, is a matter of, what is working and what works for you. And that works, and it works for as long as it works. And then it stops, and then you go to something else. And so what exercise is most useful might actually vary according to the agent and the mechanism of action of the drug that is particularly useful for you. So it's a little complex, but in general, I can say that getting to 150 minutes a week of aerobic activity at a moderate intensity is worthwhile doing for the metastatic patients, and finding a way to do resistance training safely within the bounds of those bony met issues. And, like I said, I'm happy to talk to Michelle about some of that offline and have you share that with the community.
We absolutely will. We're very proud that one of our signature programs, 2Unstoppable Strong, which is our progressive group exercise program, originally designed for women who had completed treatment within the last year. We recently launched, we've done now 2 groups of the women with metastatic cancer, and that's been very successful. A couple of our participants are here tonight listening in. So we're really happy that we've been able to implement that new program, and we will be continuing to offer that program. So we did have a couple questions, Ilana. I'll let you field the questions from the chat and the Q&A.
All right, so definitely, Katie, if you can address a little bit about the Cancer Exercise app.
Yes. Okay. So the Cancer Exercise app was developed by my dear friend and colleague, Anna Schwartz. And it is at this point, I have talked to her about this. So I know it is only available on the iOS platform, which is Apple. And, she'd love to find some funding to be able to do the development work to make it available for Android, but that is not a current reality. If you are looking for similar types of support, I would send you to one of 2 places. One is, I do have a website that goes with the book. It is www.movingthroughcancer.com. So there's a lot of information there. And in addition, there is a website for my team at Penn State, the One Group. So if you Google One Group Penn State, you will find our website, and there is a treasure trove of exercise videos and programming available there. But, I also have to say, I feel silly saying any of that while I'm on the line with 2Unstoppable, who does such amazing virtual exercise work. So you're home, you've got it.
We actually value all the legitimate exercise videos out there in the oncology exercise world. And I think we have currently we have links to some of your videos on our site and under resources. So We actually recommend it too. So it's
Yeah.
all good. Very consistent.
Well, back at you. As you know, I mean, I talk about you guys in the book. So, yeah.
That's another favorite part of the
We had another question, is whether you foresee a time when oncologists incorporate prescriptions for exercise and have suggestions about how to, sorry, the question just moved, about how to monitor a patient's progress. So how do we get the medical community?
Yes,
more
I do.
involved?
So let me tell you sort of the past story and what I hope will be the future. So there was someone who for psychosocial distress in cancer, there was someone named Jimmy Holland at Memorial Sloan Kettering who was the evangelist, if you will, that came out into the community of people who developed standards for cancer care. And she managed to convince the American College of Surgeons Commission on Cancer that there needed to be a standard for evaluating, assessing, and making referrals for psychosocial distress, because there was a literature that showed that patients who were distressed did worse. They did not survive as well. And so when that standard changed, cancer centers across the United States, academic community, otherwise, all had to change things so that they had to adopt a psychosocial distress thermometer idea. So they basically would ask people about their distress in 4 different areas. And if they were distressed, then they would make appropriate referrals. Sometimes it was psychosocial distress, sometimes it was financial distress, et cetera, right? So they would make the appropriate referrals. That has been incorporated into cancer care. Do you remember being asked about psycho? I remember watching them do it once with you. Do you remember being asked? Do you guys remember being asked about distress? Michelle?
I know I filled out at least one questionnaire about that.
Yeah.
One of my phases had someone else just answered no.
Oh, yeah.
Personal
Yeah,
experience.
it's interesting because it's supposed to be done on a regular basis, not at every appointment, but it's supposed to be done on a regular basis. Okay. And it's a standard in there, and they have to document that they've done it and all of that. And so I'm telling you this history because I am working with the National Accreditation Program for breast centers to try to make exercise a standard, okay? So that it becomes required within the standards for medical oncology in particular to try working on the surgeons, working on it. But medical oncology one step at a time, for medical oncology to recommend exercise to their patients. And it's in the standard now. And there's a few more layers it has to go through, but the point is we're trying to get to the place where it will be a standard, where it is a requirement of care that in the setting of medical oncology in particular, that they would recommend that you exercise. And interestingly, I tried to get them to say that they would refer people to exercise because that's a stronger word. And they said no, because we have to have it be possible for every breast center across the United States, and not all breast centers have access to a program.
Now that exercise is going virtual,
that's what I said. So yeah, so we'll keep working on it. We'll keep working on that. I'm hopeful that the answer to that question is yes, that we're going to get there.
So we've had a couple people responding, and some were asked those questions, some were not. And one answered she was only asked during radiation. And that was my recollection. The only time they asked me those kinds of questions, psychosocial, was during radiation. And I think Ilana and I have talked about our dream being, in that list of questions they do ask you, how's your appetite? How's this? How's that? They ask you, what are you doing for exercise?
For exercise,
every single time. What are you doing for exercise? There's another question that just came in through the Q&A. Can getting doctors to refer for physical therapy be a gateway to exercise? And we'll do a 1-minute answer to that, and then we'll wrap up.
Yes. So I think, we have a workforce problem, whether we refer people to exercise professionals or whether we refer people to physical therapists. We currently do not have an adequate workforce in either place to serve the needs of all of the cancer patients that are diagnosed. 1.8 million people are diagnosed with cancer in this country every year. And if we were to send even a third of those to physical therapy in order to receive some kind of rehabilitation, exercise programming, it would overwhelm the system in a big way. So you've hit on something very important. Physical therapists are very much a part of the solution. And what we need is a triage system that sends the appropriate people to physical therapy and sends the appropriate people to 2Unstoppable. And those are not the same people.
So one last quick question for both of you. What is the best reason to exercise for this community? What's the best reason?
Oh, well, Sarah got into boxing.
Oh, yeah.
When we were in the midst of the reconstructive thing. And
literally we were sitting, I don't mean to cut you off, but
Okay.
we were sitting at this little craft pub and we were talking about stuff and I was like, I just want to hit something. And we turned around and there was a title boxing.
Right?
Wow.
She was so mad. She was so mad about everything, you know.
Mhm.
And so I think empowerment.
Empowerment. Yeah.
That's where I would go, is that it gave her, I write about in the book that it gave her mojo back, you know. It was like I got my Sarah back. She was, she was a frightened rabbit, for I don't know how long. And
years.
yeah, and then, she really started to fight. I mean, she was fighting, but she really sort of came back into herself.
Yeah. Well, you've probably, when you're going through treatment and cancer, you're just so overwhelmed with everything. You just can't even figure out which way is up.
Mhm.
And so it's just, you don't even know who you are. And then for me, physically, I mean, I was an alien because of everything, what I look like.
Yeah.
Right.
Yeah. Some people are agreeing with you in the chat here. And yeah, so I hear you. Empowerment is a great reason to get moving.
And I would second all of them. Yeah.
You would second that?
Yeah, it just gives you, I mean, the fact that I'm now like training for a half marathon, like I feel like I started getting in better shape through after.
Oh, she's in much better shape now than she was before cancer.
Yeah, it's
Me too.
and it's
Me
like,
too.
wow, I'm doing this, I can do this. This
Yeah.
is really cool.
And you realize that once you develop these habits and you get into this and you have these reasons, you have a real motivation. You call it a motivational moment in the book to start exercising. But then you realize that this is for life. This is not just for now. This is for life.
Right.
Yes.
Because I want my life, yeah.
And I feel like, I'm taking care of all of my organs and systems that took care of me all the way through it.
Yes. Yes. So I'm gonna, it is at the end of our hour. People are really appreciative and thanking you. I want to thank you both so much for joining us. We are grateful and honored and delighted to have had this conversation with you. We were delighted to be able to have access and start reading and promoting this book to everyone, because we think it's such a valuable resource for so many. And it's just so consistent with our messages. And we really appreciate you taking the time tonight, and to both of you for everything that you've contributed to this book. And I say both of you. So this book, Moving Through Cancer, is an amazing resource for all of us. I'm going to be recommending it to everyone I know.
Yeah, she's pretty awesome. So.
She is pretty awesome.
She even knows how to draw doors now. She's kind of an architect.
Thank you, everyone. I'm going to pause the recording